Welcome to Doctor Daily, your one-stop shop for medical news and knowledge. Please like and subscribe to stay up to date with all things medical. In this video, we will the signs and symptoms your body will display when you have low levels of vitamin D. Vitamin D is an extremely important vitamin that has powerful effects on several systems throughout your body. Unlike other vitamins, vitamin D functions like a hormone, and every single cell in your body has a receptor for it. Your body makes it from cholesterol when your skin is exposed to sunlight. It's also found in certain foods such as fatty fish and fortified dairy products, though it's very difficult to get enough from diet alone. The recommended daily intake is usually around 400 to 800 international units, but many experts say you should get even more than that. Vitamin D deficiency is very common. It's estimated that about 1 billion people worldwide have low levels of the vitamin in their blood. According to a 2011 study, 41.6% of adults in the US are deficient. This number goes up to 69.2% in Hispanics and 82.1% in African Americans. Here are 7 common risk factors for vitamin D deficiency. Having dark skin. Being elderly. Being overweight or obese. Not eating much fish or dairy. Living far from the equator where there is little sun year-round. Always using sunscreen when going out. Staying indoors. People who live near the equator and get frequent sun exposure are less likely to be deficient, as their skin produces enough vitamin D to satisfy their body's needs. Most people don't realize that they're deficient, as symptoms are generally subtle. You may not recognize them easily, even if they're having a significant negative effect on your quality of life. Here are 8 signs and symptoms of vitamin D deficiency. 1. Getting sick or infected often. One of vitamin D's most important roles is keeping your immune system strong so you're able to fight off viruses and bacteria that cause illness. It directly interacts with the cells that are responsible for fighting infection. If you often become sick, especially with colds or the flu, low vitamin D levels may be a contributing factor. Several large observational studies have shown a link between a deficiency and respiratory tract infections like colds, bronchitis and pneumonia. A number of studies have found that taking vitamin D supplements at a dosage of up to 4,000 international units daily may reduce your risk of respiratory tract infections. 2. Fatigue and tiredness. Feeling tired can have many causes, and vitamin D deficiency may be one of them. Unfortunately, it's often overlooked as a potential cause. Case studies have shown that very low blood levels can cause fatigue that has a severe negative effect on your quality of life. Even blood levels that aren't extremely low may have a negative impact on your energy levels. An observational study in female nurses found a strong connection between low vitamin D levels and self-reported fatigue. What's more, the researchers found that 89% of the nurses were deficient. 3. Bone and back pain. Vitamin D helps maintain bone health in a number of ways. For one, it improves your body's absorption of calcium. Bone pain and lower back pain may be signs of inadequate vitamin D levels in the blood. Large observational studies have found a relationship between a deficiency and chronic lower back pain. One study examined the association between vitamin D levels and back pain in more than 9,000 older women. The researchers found that those with a deficiency were more likely to have back pain, including severe back pain that limited their daily activities. In one controlled study, people with vitamin D deficiency were nearly twice as likely to experience bone pain in their legs, ribs or joints compared to those with blood levels in the normal range. 4. Depression. A depressed mood may also be a sign of vitamin D deficiency. In review studies, researchers have linked vitamin D deficiency to depression, particularly in older adults. In one analysis, 65% of the observational studies found a relationship between low blood levels and depression. On the other hand, most of the controlled trials, which carry more scientific weight than observational studies, didn't show a link between the two. However, the researchers who analyzed the studies noted that the dosages of vitamin D in controlled studies were often very low. Some controlled studies have shown that giving vitamin D to people who are deficient helps improve depression, including seasonal depression that occurs during the colder months. 5. Impaired wound healing. Slow healing of wounds after surgery or injury may be a sign that your vitamin D levels are too low. Results from a test tube study suggest that the vitamin increases the production of compounds that are crucial for forming new skin as part of the wound healing process. One study on people who had dental surgery found that certain aspects of healing were compromised by vitamin D deficiency. It's also been suggested that vitamin D's role in controlling inflammation and fighting infection is important for proper healing. One analysis looked at patients with diabetic foot infections. It found that those with severe vitamin D deficiency were more likely to have higher levels of inflammatory markers that can jeopardize healing. Unfortunately, there is very little research about the effects of vitamin D supplements on wound healing in people with deficiency at this point. However, one study found that when vitamin D deficient patients with leg ulcers were treated with the vitamin, ulcer size reduced by 28% on average. 6. Bone loss. Vitamin D plays a crucial role in calcium absorption and bone metabolism. Many older people who are diagnosed with bone loss believe they need to take more calcium. However, they may be deficient in vitamin D as well. Low bone mineral density is an indication that your bones have lost calcium and other minerals. This places older adults, especially women, at an increased risk of fractures. In a large observational study in more than 1,100 middle-aged women in menopause or postmenopause, researchers found a strong link between low vitamin D levels and low bone mineral density. However, a controlled study found that women who were vitamin D deficient experienced no improvement in bone mineral density when they took high-dose supplements, even if their blood levels improved. Regardless of these findings, adequate vitamin D intake and maintaining blood levels within the optimal range may be a good strategy for protecting bone mass and reducing fracture risk. 7. Hair loss. Hair loss is often attributed to stress, which is certainly a common cause. However, when hair loss is severe, it may be the result of a disease or nutrient deficiency. Hair loss in women has been linked to low vitamin D levels, though there is very little research on this to date. Alopecia areata is an autoimmune disease characterized by severe hair loss from the head and other parts of the body. It's associated with rickets, which is a disease that causes soft bones in children due to vitamin D deficiency. 8. Muscle pain. The causes of muscle pain are often difficult to pinpoint. There is some evidence that vitamin D deficiency may be a potential cause of muscle pain in children and adults. In one study, 71% of people with chronic pain were found to be deficient. The vitamin D receptor is present in nerve cells called nociceptors, which sense pain. One study in rats showed that a deficiency led to pain and sensitivity due to stimulation of nociceptors in muscles. A few studies have found that taking high-dose vitamin D supplements may reduce various types of pain in people who are deficient. One study in 120 children with vitamin D deficiency who had growing pains found that a single dose of the vitamin reduced pain scores by an average 57%. The bottom line. Vitamin D deficiency is incredibly common and most people are unaware of it. That's because the symptoms are often subtle and non-specific, meaning that it's hard to know if they're caused by low vitamin D levels or something else. If you think you may have a deficiency, it's important that you speak to your doctor and get your blood levels measured. Fortunately, a vitamin D deficiency is usually easy to fix. You can either increase your sun exposure, eat more vitamin D-rich foods, such as fatty fish or fortified dairy products. You can also find a variety of vitamin D supplements on Amazon. Fixing your deficiency is simple, easy and can have big benefits for your health.